from current analog treatment protocols, the planning phases in digital protocols are now much more developed, much more challenging, and much more demanding in a time consumption. And once you adapt the appropriate treatment plan, then the execution goes really faster and efficient and much more predictable. I'm a Dr. Igor Ristic. I come from Belgrade. I'm specialized in prosthodontics. I'm also currently serving as a president of European Society of Cosmetic Dentistry. And I love coming to dental world, and I think this is my third time here that I give a presentation. I think every 4 to 5 years I'm invited, and I really love the way everything goes and improves, and it's perfect. The topic of my lecture was implementing digital workflow in a current clinical environment. And this is a topic that is honestly quite challenging for most of us, and even me today. The technology seems to be faster than we want it to be, and it's changing dramatically in a way it performs. By the other hand, it influences our clinical workflow. So for the dentist, regular dentist that is basically focused on treating people, to diagnose, to make treatment plans and to execute, it's very demanding to follow these technological advancements of the equipment that is in his surrounding. So very often we are faced with decision what to buy, how to buy, what to acquire, and unlike to past times when some part of equipment lasted for almost a decade, now the parts of equipment are changed like an iPhone or some gadgets, and it's very important to use them properly in order to squeeze from them all capabilities they are capable. So this is something that is now very challenging to discuss. My goal was to introduce some steps in our clinical workflow that could be changed with the digital equipment. What are the steps of analog workflow that should be still remained or kept as a checkup procedure, and how young dentists could adapt to that. Take-home message should be that from current analog treatment protocols, the planning phases in digital protocols are now much more developed, much more challenging, and much more demanding in a time consumption. And once you adapt the appropriate treatment plan, then the execution goes really faster and efficient and much more predictable. I just came, but after the lecture I would look around and I'm going to meet some friends from the industry and also some peer doctors, and I'm really looking forward to discuss with them different aspects of our profession. It's always a great chance. I think the whole Hungary is here. I think the dental world is guided by very capable people, and they are really using very smart concept, introducing the dental fair, equipment industry, production, and also with lectures. On the other hand, they insist on hands-on sessions, which is really great mix. So everyone that comes here is going to have at least 2 full days of knowledge, expertise, and get some new skills. I would really recommend everyone involved in a clinical dentistry, also from laboratory side and a clinical side, to at least once a year come to dental world in Budapest and see old new stuff that are new equipment and devices in dental world and dental technologies, and gain knowledge how to use it. So having some device is not going to make you a better dentist, but knowing how to use it properly and when to use it is going to definitely influence a lot in your daily clinical protocols. So take your time and have fun in a dental world.